So you've hurt yourself. Nothing serious, but just enough to impact your life so that you're kind of annoyed. Maybe you can't bend your arm, maybe you can't turn your head, maybe you can't climb the stairs, whatever it is. It's very likely that a problem of this nature is a musculoskeletal condition. Physiotherapists treat musculoskeletal conditions and injuries. And so do chiropractors. This is confusing because as a person with physical pains, you may not be sure which profession would be better for you. This isn't actually a surprising question to be asked. In fact, students at CMCC, which is Canada's largest chiropractic school, know this and test us on it in role-playing examinations. In this video, we'll be providing the difference between physiotherapists and chiropractors, as well as highlighting what CMCC would consider to be a good answer and what my personal answer would be after being in practice. Quick disclaimer time. The scope of practice and educational requirements to be both a physiotherapist or a chiropractor will differ depending on wherever you're living. For example, within Canada, it only requires 2 years and a master's degree in order to become a physiotherapist. However, within the States, a Doctor of Physical Therapy program is actually 3 years. As well, the scope of practice will differ depending on whichever province or state you're living in. Again, comparing the two countries, Canadian chiropractors can only refer for X-ray imaging, whereas they can refer for MRIs and CT scans within the States. Because of these differences, this video will only pertain specifically to Ontario practicing providers. This means Ontario physiotherapists and Ontario chiropractors. As well, I am obviously a chiropractor, not a physiotherapist. It's very likely that some of the intricacies of the physiotherapy profession are lost on me. However, I will be offering the insights that I know from my chiropractic perspective by the answers that CMCC would grade me on, as well as, again, what my personal opinion and experience is now. If you are a physiotherapist watching this, I would actually love to hear your comments down below on what your answer to this is, because hey, I want to learn more about you and I hope you want to learn more about me too. All right, let's get into it. Starting off with the CMCC answer. The difference between a chiropractor and a physiotherapist is important to be aware of. Firstly, chiropractors have more years of education underneath their belt. To become a chiropractor requires 4 years of postgraduate level study, hence earning them the doctor title. To become a physiotherapist requires completion of a 2-year master's program. Chiropractic education is more broad, so they may be able to catch conditions that are non-MSK but present as such. Chiropractors are able to diagnose conditions both inside and outside of the musculoskeletal system. This means that we can diagnose nerve-related problems. Physiotherapists are limited to only being able to diagnose the musculoskeletal system. As well, chiropractors are also able to refer directly for medical imaging, specifically x-rays. Physiotherapists are not. Alright, CMCC answer over. In my opinion, that would have gotten at least a 90. As you can see from the CMCC answer, we're really made to focus on the educational and title difference between chiropractor and physiotherapist. And while that is objectively true, I actually don't consider it to be the greatest answer. This is because in my experience after working with patients, truthfully, they don't really care. At least not as much as some of us are led to believe. The two things that in my experience a patient actually cares about are A, can you get me better? And B, how much is this going to cost? And if the patient is particularly affluent, they might actually just skip B. And at the end of the day, chiropractors and physiotherapists are both very, very effective at treating the same scope of conditions. This means that whether you see a physio or a chiro, you will very likely improve if your condition is MSK. As well, at least within my area of Ontario, which is the GTA, the price comparisons between physiotherapy and chiropractic are pretty moot. So this CMCC answer doesn't actually address either of the two most common concerns that a patient has, at least coming into my office. As such, I don't think it's even a passable answer. Onto my personal thoughts regarding this, a good answer towards this question of what's the difference between a physiotherapist and a chiro will first address those two main concerns and then address the tertiary concern that hasn't been voiced yet. That tertiary concern is usually, how are you going to do that? So let's pretend somebody just asked me, hey Adam, what's the difference between a physiotherapist and a chiropractor? That's a very common question that I get actually, and the truth is that chiropractors as well as physiotherapists are both very effective at treating the same scope of conditions. As well, from a price perspective, they're going to be very comparable, maybe plus or minus $15 depending on the individual practice. And boom, just like that, the patient's two primary concerns are addressed. At this point, the patient may follow up by asking how are they different as far as the treatment methods actually go. And this is where the bulk of the answer actually comes in. To the best of my understanding, when you visit a physiotherapist's clinic, you very likely know what you're going to get. To nobody's surprise, physiotherapists are experts in structured rehabilitation towards musculoskeletal injury or conditions. This also includes the pelvic floor musculature, which is why there's been a very large upshoot in pelvic floor physiotherapists lately. A typical physiotherapist Chiropractic's treatment plan will include structured rehabilitation with exercises that will increase in difficulty as your condition improves. As well, you will likely receive several forms of passive care where the practitioner will be working directly on you, whether that's acupuncture or hot compress or massage. And then you may also receive some form of modality, which would be a machine on you, either ultrasound, laser, or shockwave. The exact amounts and the ratio of each treatment style that you'll receive will probably vary dependent on the individual practitioner, but for the bulk of the time, this is going to be the case. For that reason, it's very likely to almost predict what you're going to get before going in. And it's this consistency that relates to medical doctor referrals for patients who do have MSK conditions. Majority of MDs will still default to saying see a physiotherapist because they can be confident in their assumptions of what that patient will be receiving when they go there. Now, when seeing a chiropractor, there can be some ambiguity in terms of services received. And I know this because every patient that comes into my office, one of the first questions I ask them is, have you seen a chiropractor before? And what did they do that you either liked or did not like? Some chiros only adjust or crack. 2 to 3 minutes in the room, on to the next patient. Other chiros don't use their hands. Instead, they rely on a small clicking tool, which we refer to as an activator. Some chiros are more akin to physiotherapists, relying entirely on structured rehab. And some chiros get real weird and don't even put their hands on the patient or rely on exercise. Honestly, I'm kind of embarrassed even mentioning those ones, but my guilty conscience mandates full transparency in exchange for full night's sleeps. And then occasionally I will get a patient who tells me that the chiropractor they were seeing before me treats in a very similar style to what I do. And while I'm obviously very biased towards my own treatment style, I do genuinely believe that it's this particular style that will help to push the chiropractic profession forward in the public eye. To reinforce that point, I asked the patient, if you were enjoying that chiropractor so much, why come to me? And their answer is usually because that chiropractor is fully booked for the next 2 to 3 weeks and I can't get in. That's a pretty good sign that patients like that style. These chiropractors, again, same style as me, spend more time with the patient and through their diversified knowledge of different treatment methods and conditions are able to identify root causes of problems and then ultimately treat it with the most effective methods for that specific root cause. This particular style can be referred to as diversified, or in some cases evidence-based. Specifically, the diversified refers to the multitude of different treatment methods available to us, instead of relying solely on one thing, such as adjusting. These chiropractors do basically everything a physiotherapist does, and alternatively, physiotherapists do basically everything these chiropractors do. Structured rehab exercises, lifestyle modification and ergonomics, nutrition planning, passive therapies like massage and acupuncture, modalities like the ultrasound, shockwave, and laser machine. The only thing that I would argue that chiropractors have over physiotherapists in this one is our ability to adjust, which at the end of the day is an absolutely undeniable thing for treating certain conditions just like that. Emphasis on certain conditions. It is not the sole solution for a whole hell of a lot of them. In conclusion, when we compare a physiotherapist to this specific type of diversified chiropractor, it's kind of a moot conversation. These two professions are very, very similar and treat the same scope of conditions, and they'll both be very effective in getting you better. If you've been trying only one for a while and haven't been improving, or perhaps your progress has plateaued, consider trying the other. A fresh set of eyes and a new set of skills may be just what you need to push your recovery further. And you can always switch back to the other one if you end up not improving. The additional skill of adjusting that chiropractors have over physiotherapists may be beneficial to a specific group of musculoskeletal conditions. However, given that it can be difficult to predict exactly what you're going to get before seeing a chiropractor, if the idea of consistency is more appealing to you, it may be more convenient to just see a physiotherapist. It's this know what you're going to get mindset that allows MDs to so readily refer out to physiotherapists versus chiropractors. They can't really be super confident in their assumptions. In order for the chiropractic profession to grow and become more referral immediate from MDs, I believe it's important that we continue to push towards this diversified skill set that I myself do employ and the fully booked chiropractors that I hear of employ in order to be better accepted by the public eye. This lets us be far more comprehensive in our treatment style and is kind of what I think every doctor should be pushing to do. Thank you so much for watching, guys. As always, if you have a spare 3 seconds, please subscribe down below. It will help me to buy organic. Also, we've hit 300 subscribers, which is absolutely amazing considering the previous goal was only 100. So again, thank you so much. New goal, 1,000. I really do appreciate all of your help with this. You can click here for the previous video and you can click here for the next one. Have yourselves fantastic days.